Well, healthcare in India, especially for the common man, is quite abysmal. By God's grace, if you're able to catch an ambulance, the next thing you know, you're stuck in traffic. But there is a glimmer of hope. A lot has been tried out as to how to ensure timely medical aid to provide to those in distress. While medical aid coming through air may sound heroic, it was only limited to the deep pockets. But now it can be made available for the common man too. Here's what we're talking about.
Traffic in cities is so vicious. It eats away precious time. It's always a question of life and death treading on Bengaluru roads, but all is not over. While stats do not paint a favorable picture of medical care in the country, doctors from the state are working on achieving a faster and more accessible medical care within the golden hour. The golden hour, also known as golden time, refers to the period of time following a traumatic injury during which there is the highest likelihood that prompt medical and surgical treatment will prevent death. While initially defined as an hour, the exact time period depends on the nature of the injury and can be more than or less than this duration. This period could well be the deciding factor between life and death. Flying doctors and paramedics to save the day. A mock drill was conducted in the city to emphasize the need of air ambulances. In this drill, a helicopter enabled with state-of-the-art medical services flew from Bengaluru to Mandya and back, all to save a mother and her infant injured in an accident within the golden hour. The distance of 2.5 hours was cut down to just around 30 minutes. Around 27% deaths in India occurred due to non-availability of medical care during the golden hour. Here's a lowdown on how the mock drill panned out. Time of accident 8:30 a.m. Assuming the local medical services are inadequate to treat the patients, an air ambulance is called in to airlift the injured to a better hospital. 9 a.m. Air ambulance flies from Whitefield to Mandya. Doctors and paramedics attend to the mother and the infant. They stabilize the injured in order to airlift them. 10 a.m. Air ambulance reaches Bengaluru. While the mode of transportation is the core difference, the directors of ICATT, the firm leading the change, said it goes beyond the vehicle.
Air ambulances are still quite rare in India, but there is a firm that is trying to bring this to the forefront, and we have with us the pioneers of the same in India. So let's go ahead and speak to Dr. Shalini, one of the directors. So can you tell us more about what kind of services you will be offering and how it's going to contribute towards the healthcare in India?
So you just now witnessed a live drill which was demonstrated, done 120 kilometers away from Bangalore. These people they responded by the chopper and they resuscitated both the lives and brought them back to Bangalore, which is the tertiary care center, which is the right place for them to be for the further intervention.
Okay. That sounds great, but let us go ahead and speak to Dr. Satish about the feasibility to the common people, like you and me, like how the common people are going to be accessible to this kind of facility.
ICAT would work along with the government so that it could be made very affordable or even free of cost. So that's one aspect. I would like to say it's non-existent in India until now, absolutely non-existent. And even if it did, what it was an ad hoc travel or an ad hoc transport.
All right, let's go over to Dr. Neil over there. Sir, can you tell us how it is in United Kingdom and how India can work towards it?
So it's a very well publicised fact that the death toll on the Indian roads is very high, one death every 3 minutes. What is less well publicised perhaps is the additional fact that for every death on the road there are probably at least 2 or 3 patients who are suffering long-term life-changing injuries and need care for the rest of their lives. And just to try and understand the impact of that, we just need to think for a minute how something like that, an injury like that, would affect our families. If we want to make inroads into those figures, into those statistics, We need in India to adopt something similar to the systems we have in the Western world, in the UK and the United States.
So, Dr. Rahul, can you also tell us some of the obstacles you faced while implementing this idea in India?
We faced a lot of obstacles. The biggest obstacle was there was lack of integration between the healthcare, the aviation, and the financial services. So our biggest challenge was integrating this service not just as a standalone, but an extended arm of the emergency department and the intensive care unit, where the services can be provided on site.
And my one last question to you, Dr. Rakul Preet. Sir, India right now ranks 145th in the global healthcare. So do you think that initiative like this is going to change that ranking anytime soon? And how do you see it in the next 5 years?
So that's a very good question. Thank you. I think we rank quite lowly at this point in time. This is an emergency service. Yes, this will play a small part in the big jigsaw puzzle that we are dealing with in India. And if we put pieces together slowly, I think we are on our way up.
Now, those were the pioneers of the air ambulance services here in India, which is going to be free of cost, as they say it. This is not the similar ones as the private ones that we have, which people have to shell out a lot of money to get these services for. So it is only hopeful that in the future, in the next coming years, that the common man is also able to access this kind of a better state-of-the-art healthcare.
Well, you heard it all from the change makers in the field of medication. The air ambulance also encompasses neonatal services.
Dream in Karnataka state is to bring down the neonatal mortality rate to single figures. We are now almost about 27 deaths per 1,000. What we have realized is less than 28 weeks of gestation, if the babies are born, in the wrong place, more than 90% of them die. So in the right place, the survival goes up to about 90%. So what we can do with the air ambulance is try and shift those kind of babies from the remote possible areas into the tertiary centers.
Dr. Shalini is also in talks with the central and state governments to implement the idea on a larger scale and make it accessible to the general public. ICATT has one air ambulance at the moment and plans to induct another if the state government accepts their proposal. Deputy CM Dr. Ashwath Narayan, who attended the event, reacted on how air ambulances could help elevate India's global healthcare ranking.
This is one of the factor with regard to the emergencies. This is basically to do with more of emergency, to reach out to the people who can't get the best facility in their vicinity. So to address this concern, this emergency services, this is basically to do with the emergency. And moreover, many things are happening. If you look at the manpower, creation of the manpower, medical colleges, infrastructure, hospital, there is a lot of encouragement. We are looking for how best we can improve the health services. And technology is going to play a very big role. Technology will be the hope.
ICATT hopes to slash the number of deaths due to lack of timely medical services by a significant margin by cutting down on commute time. The state government is yet to accept the proposal, and it needs to be seen how effective and feasible air ambulances will be here in the state. Amrita for News 9 Bengaluru.